What are the deadliest diseases and what is it like to die from them? Here's what to expect when dying from COPD. So I know this is really scary to talk about, really scary to think about, but from my experience, the more you know about the disease that you may be dying from, the better you will live and the more peaceful you will die. This may feel scary to talk about, but from my experience, the more you know about the disease that you may be dying from, the better you can advocate for yourself. And if you can't advocate for yourself, the more your family members know, they can better advocate for you. So what is COPD? COPD stands for Chronic Obstructive Pulmonary Disease. So it's a lung disease. And really, in order to come on hospice with COPD, you have to be very, very end stage. So what does end stage COPD look like? Usually by the time you're coming onto hospice, you have a lot of functional decline, meaning you were out and about living your life fully, driving, walking everywhere, easily talking, going to the bathroom. And now by the time you're on hospice, it's probably even difficult to leave your house. So a lot of functional decline. Now with COPD, it is a chronic terminal illness, meaning you've lived with this for a long time already, possibly 10, 15 years. And you usually see it like plateauing along. So you're going along this plateau and then something happens. You get an infection, you get bronchitis, something, and you go downhill. And then you're down here. While you're down here, you may come on hospice. And sometimes, a lot of times, while you're on hospice, you actually crawl back up and then you plateau out here. So you're no longer up here, but you're no longer down here and you're plateauing now here, meaning you can actually come off hospice. So a lot of people with COPD come on and come off hospice. Here are the main symptoms that you'll be experiencing with COPD. So first and foremost, number one is shortness of breath. You'll usually come onto hospice already on oxygen continuously, already on a nebulizer machine, which just gives you albuterol or Atrovent, different medications through a nebulizer machine. A lot of times you'll have inhalers and steroids. So steroids at end stage COPD can really help with that shortness of breath. And most everybody who is on hospice with COPD will be on all of these medications. So what are the main symptoms you'll see with COPD? So first and foremost, shortness of breath. Hands down, the most common symptom you'll see, and sometimes only symptom you'll have with COPD. Most people with COPD who are coming on hospice are already on 24/7 oxygen, meaning oxygen all the time. They'll have medications like inhalers and nebulizer machines that will help open up their airway, and then they usually start going on to daily steroids to help with their shortness of breath. The other things we see are not necessarily symptoms, but basically problems that come up because you're so short of breath. So you will start eating less, you'll start sleeping more, and you'll start having a functional decline, like I said before. So before you were able to get up and walk outside, go downstairs, go shopping, and now it's just difficult for you to walk from your bed to the bathroom. So this is how we manage your shortness of breath on hospice. We almost always use morphine. Now people always ask me, what if I'm allergic to morphine? If you're allergic to morphine, we will find something else for you. But basically, you need to have something like morphine to relax your central nervous system, relax your diaphragm, so you can take away that feeling of air hunger. So people always have a fear who have these lung diseases, like, am I gonna feel like I'm suffocating to death before I die? The answer is no, especially on hospice. If you're on hospice, no, you're not gonna feel that. We are going to medicate you so you do not feel that air hunger. However, there is a downside to that, right? I always say we can control and manage your symptoms on hospice, especially with COPD, but because we are treating it usually with morphine, sometimes some kind of benzo, so Ativan, usually Ativan, you'll be lethargic. So you're not going to be short of breath, but you will be lethargic. So your quality of life will go down, but you will not have that feeling of suffocating at the end of life. So overall, we can make you very comfortable. So we are talking about COPD, but when I say COPD, I also mean emphysema or even some lung cancers. So a lot of times lung cancers, emphysema, COPD, anything with the lung, pulmonary fibrosis, which is a whole nother story. Essentially, the main symptom will be shortness of breath. So although the main symptom that we'll be managing as a hospice team is shortness of breath, the other thing you'll be going through as the person with COPD or the family member watching and caring for this person is the functional decline. So you are going to be, like I said, sleeping a lot. And then towards the end of your life, very, very end, you're gonna be sleeping 22, 24 hours a day. You'll have a functional decline. So you used to be able to fully take care of yourself, and now you are bed to chair and you need assistance. So there is a lot of that will go into your caregivers as well, trying to care for you. Food and water, that will decrease a lot. You will see that you're not really hungry, you're not really thirsty. A lot of that has to do because you're end of life, but also because with COPD, your body is working so hard to breathe that you stop feeling hungry and thirsty. Now, that sounds scary. We can help you with that feeling of I need to breathe and feels like I can't with so many different medications. There's so many things we can do to help manage that feeling, manage that symptom. The side effect of that, of course, is being lethargic. Thanks for watching, and let me know what disease you'd like for me to do next. And don't forget to subscribe for more death and dying information.